All right, we are now officially live. That was so easy. Dr. Joshua Trubeck is a medical toxicologist and emergency physician at the University of Iowa Hospitals and Clinics. He completed his medical school training and emergency medicine residency at Johns Hopkins Hospital and completed his toxicology fellowship here at NYU. Currently in Iowa, he's a clinical assistant professor of emergency medicine. He's the director of the resident medical toxicology education program and is the assistant medical director of the Iowa Poison Control Center and also a consultant to the Nebraska Poison Control Center. All right, Josh, thank you so much for coming again, and please take it away.
Oh, well, thank you. Thank you, Mark. You know, something happens after you become, after you graduate from fellowship, people stop introducing you like, here's Josh, take it away. They give this like long speech, and it's like I'm still not used to it. So it's very kind. But it's fun to be on the other side of things right now, giving the talk here at Grand Rounds. So thank you for having me. I'm really excited for doing this. And what I'm talking about today, I think because Dr. Sue couldn't find anyone else to fill in, is toxicology education on social media. And I know everyone here has different opinions on social media in general. What I will say is that I am not here to change your mind one way or the other. I'm just letting you know sort of my own journey into social media, and I think this is something that we're seeing become more and more popular and is worth talking about. I've gotten a lot of questions about it, so I figured we'd sort of jump right in. I don't anticipate this taking the whole hour, so I usually like to preface it with that. So to start, I have no financial disclosures. And here are our objectives today. We're just going to briefly discuss social media platforms for people who are unfamiliar with them, just so we're all on the same page. We will briefly hear about my journey. I know sometimes I don't think anyone really wants to hear me come up and talk about myself too much. So I'll try and keep that brief, just to sort of let y'all know where I started and where I am now. And then we'll explore tox education on social media. So when we think of social media, there's a ton of stuff out there. I think people always think of like these apps, like the ones I pictured here, like Facebook, Twitter, TikTok, etc. But social media can really be any sort of platform that you can access through the internet, on your computer, on your phone, tablet, etc. Social media can be things like blogs. It can be podcasts. There's a ton of different things out there. I'd say a big 5 apps that people like to think about when they think about social media are pictured here on the left, and moving to the right. We have Facebook, which sort of rose in popularity and has started to decline over time. I'd say as far as Facebook goes, with respect to social media education, you can have groups on Facebook, but those groups tend to be closed, and so you can't really see what's going on in one group. So they're good for like closed group discussion. Moving to the right, we have Twitter, which is a pretty platform that has increased in popularity, not just due to recent change in leadership. It's getting more attention, either good or bad, but is something that's used by the public, by professionals. There's not these close-knit groups. You can actually see anything that anyone really posts unless your account is set to private. But I feel like a lot of my own experience with social media education is on Twitter. And there are actually a decent amount of health professionals that are on Twitter doing different sort of social media educational endeavors, and we'll dive into that shortly. TikTok is something that is quite popular amongst the youths. And what I'll say is that TikTok is basically just these very, very short videos, sometimes seconds, sometimes 15 seconds. Usually the ones that do great tend to be shorter videos. Basically just sort of filming. It's very quick cuts to different things. And sometimes you can have a video side by side, another video. And there's a algorithm that will tailor the videos that you like to what you're interested in. And some people have taken it on to do different educational content on TikTok. It is a little bit challenging though, given the limited time frame you have for some of these videos. YouTube is a big one that I think many of us are familiar with. There is no real time limit you can put on the videos that you make on YouTube. There are some great great lectures and tutorials and things on YouTube that can teach you virtually anything you really want to know. And I remember back in even like high school, YouTube being really helpful for teaching me different things if I was struggling with a concept or wanted to see a video on something or just hear another professor lecture about a certain topic. And then lastly, here is Instagram, which again, you can usually Instagram is posting of different pictures, but people can do things like Instagram lives or they can do like interviews. And I've participated in a few of those things, talking to some healthcare professionals as well, just about careers in healthcare, et cetera. So all of these, including blogs and podcasts, can be used to teach about to teach about toxicology and just to educate in medicine in general. Uh, but most of my experiences come from Twitter, and so I'll be showing some examples of how I've been effective in doing social media education through social media on Twitter. Now, back when I was a medical student, I really wasn't that big into social media, to be frank. We had to make a Twitter for my pediatrics clerkship rotation. They said, "Hey, we want you to make a Twitter. We're going to ask some questions on a social media platform, and you and the other students had to log on and like answer." And it would be like, "What is this rash?" And we'd be like, "That looks like uh, like hand, foot, and mouth disease or something." And it was just a way to get students involved on social media. But that was kind of it. And I kind of really didn't do much with social media until then, from like a me actively posting things on there. Um, when I was in residency, of course, after my medical school, emergency medicine residency, I started to augment my own residency experience with different uh, social media content, specifically around EKGs and emergency medicine sort of podcasts. These are a couple of big things. The Dr. Smith's ECG blog is a pretty notable blog that has a lot of fantastic EKGs. The bottom right is something that Amal Matu has started, the ECG weekly workout, and then MRAP is pretty well known amongst the emergency medicine crew. And these were things that I used to augment my own experience as an emergency physician, and I got a lot of good education from these. I learned quite a lot, and that wasn't to say I wasn't having education provided by my residency. It was just me augmenting it, and I thought it was very effective. I started to explore different things in social media. This is just a screenshot of a tweet from like 2018 where very quick, short blurbs where people would post a vignette of some sort and an EKG. Sometimes you would see this with an ultrasound or an X-ray. And for like a intern or a second year resident, this was great for me. I was like, oh, this is really cool. This is short, it's digestible. There's comments I can read what other people have said. If I got confused and got it wrong, I can see what other people were saying. Was I the only one that felt this way? So I sort of used this while I was a resident. I never really began sort of writing my own or doing any of my own content until my program director, Dr. Linda Regan, who is in NYU grad. She has this blog for the residency called the Daily Bolus of LR, because it's lactated ringers, but her name is Linda Regan, so it's fun. Daily Bolus of LR, and she's like, "Do you want to like try and write some like educational cases for the blog?" And I was like, "Oh, sure." So I started to write some toxicology themed posts on this blog. First time I've ever done that. Of course, I don't think a single one of them got like a single comment on it or any sort of interaction, but it was good experience for me to try and have writing these cases and seeing what it takes to put something on the internet to educate people who would read it. Jump forward to this is Andrew Stolbach, is like one of my favorite people in the world, and has been a bit of a tox/life mentor to me. Andrew had encouraged me to write these toxicology cases for the emergency medicine residency program at Hopkins. And so I started writing toxicology like themed like cases with like a whodunit sort of mystery, like, oh, this patient was poisoned. Here are all the hints and the clues, like what's going on, what's the diagnosis, how do you manage it? And so at the same time that I was uh, learning how to use the social media to teach myself about emergency medicine, I was writing cases for a blog, but then also writing toxicology cases for the residency. And I said, is there a way I can combine these into a format that can be delivered onto social media? So I tried tweeting things on Twitter, and as you can tell, not many of this didn't like take off right away, right? Like these are posts I made in like 2017, early 2018, uh, with one single like, which may have been my own, and not a lot of engagement, right? But I was like, oh, like I still kind of gotta figure out how to do this. And so over time, I managed to figure out some strategies, and I'll share those with you. But I just wanted to show everyone like this wasn't something like you just start and I was like instantly flying. It was something that sort of took some time. So you're like, why do we have someone up here talking to us about like social media? Like, there's a lot of problems that we have with social media, and I think you know, physicians and clinicians in the past, I think, have been apprehensive and still reasonably so are about engaging in social media out of many concerns, be it liability, be it lack of time, be it poor familiarity with the technology. But things are seem to be changing, and I don't know if that's because more and more of the younger generation who is using a lot of social media is now becoming clinicians. But uh, a 2011 survey that was done of over 4,000 clinicians show that 90% of clinicians use at least one social media site for personal use and 65% for professional purposes. This was in 2011. And I'd say the COVID pandemic really changed things. And I have yet to see a reliable survey done since then that looked at social media trends. But I'll tell you is that when COVID happened, it really disrupted the medical education system, right? It changed the way we teach medical students, residents, fellows, the way we do conferences. Like, look at what we're doing right now. It really changed the way a lot of things, the way that a lot of teaching was done. And so people started to turn more to different social media platforms in terms of trying to teach trainees and each other. Uh, I'd say the last thing is I say lots of people are using it, not just lots of clinicians, because patients are also on social media as well, and they will sometimes use social media as a way to find information out as well. And although we all know that that's not the most reliable source of information, sometimes we would have to. I think it's worth introducing fact and the right information onto social media to help combat misinformation, especially if our patients are reading this information. So when I was a Tox fellow, we didn't really get, just because of COVID, we didn't do a lot of, at least certainly not the first year, do a lot of conferences in person with a ton of other people simply because of COVID, right? And this is not an uncommon thing. All across the world, conferences were canceled, conferences were made virtual. And so a lot of networking had to occur through the internet and through social media. And not just for myself, but for I can speaking on behalf of some of my colleagues as well who I've chatted with, a lot of networking opportunities are available on social media, and you can meet people, other toxicologists, other emergency doctors, other pediatricians, other whoever, to collaborate on projects in educational content, people you would have never met otherwise through social media. And I've definitely done some social media content and had some great opportunities just from social media alone. It does have quite a low activation energy, I think. It doesn't take a lot to simply make a social media account, and you don't even have to be active. You can be what's called a lurker, just to sort of you don't have to interact with anyone's posts or tweets or videos or whatever, right? The same way you'd go to YouTube and watch a video, you can go on Twitter and look at tweets and no one will ever know you were there. So you can lurk and see if it's something you would even be interested in. This final point is people always ask me, they're like, well, like, is there evidence to show that it works? Like that that people learn better on social media or just as good? And there are a few studies out there that, when I was reviewing this, examined the efficacy of social media in different educational endeavors. And it's a challenging topic to study. Some studies will say that there is a benefit. Others say it's unclear. But the conclusion I've seen in a lot of them is that further research is needed to further quantify like the actual benefit because it's hard to say. I think it's hard to gauge what people use social media for. Like my social media account, is it 100% purely education nonstop 100% of the time? No, I will sometimes post pictures of my cats, or sometimes I will get involved with local or national issues. So I think it's really hard to gauge, and people's role on social media doesn't necessarily have to stay consistent. It may change depending on the environment they're in or where in their life they are. Like when I was studying for Tox boards, I was completely off social media. But when I was studying during fellowship, I was posting a lot of toxicology review because that also helped me. So it varies all over the place. Sharing anecdotal evidence, which I know is very poor quality evidence, but is still evidence nonetheless, is that I have had patients, medical students, residents, APPs, physicians, news organizations, companies, etc. People have reached out to me to say, we appreciate this teaching or this education you're doing. And I don't like outwardly like bragging about like, oh, look at all these nice things I got. But as an instructor, as someone who likes to teach and likes to get feedback, some of this is actually really beneficial for me to let me know I'm on the right track about things. I'll have a medical student say, I got a question right on my my shelf exam because of you. Or I've had people say, like, I uh, brought this up on rounds today, and the team thought it was a great idea because I saw your like carbon monoxide post that you did. Or people will say like, "Oh, I was, working in the ER, and we had a couple patients came in that made us think of this post you did." And so I think it's really interesting to see the results of this because this is not really what I anticipated when I started out. And this is just a few of the comments that I've received just by sharing toxicology and things about medicine on social media. And what's interesting is that like it's not just like medical schools like here in the or like students or trainees here in the United States. I've had people from other countries reach out. I've had people take the posts that I've done and turn them into podcasts and make different like educational deliverables out of them. I've had like classrooms or like high schools like take some of the toxicology concepts and turn them into like lesson plans for their students. It's very interesting. I don't think I even at this point fully appreciate just how far it can reach. Because if you had asked like, oh, has a high school teacher like taken your post to teach students about toxicology, I would say that sounds ridiculous, but seems like it happens. So it's very, very humbling. Uh, that being said, there are a few points to remember when it comes to social media, and I bear with me. Sometimes this may feel obvious, but I feel like it needs to be said. So number one is that everyone can see you. And so what do I mean by that? This means that not just your friends and your family, but also your job, also your patients, also your colleagues. So if you are saying ridiculously inappropriate things wherever you decide to draw that line, you just have to realize that people can see that. And there have been cases, especially I've seen on Twitter, of people losing their jobs or getting into a lot of hot water with their employer over the things they've put on social media. So everyone has their different thresholds and different sort of theories about where they draw that line, but just please keep that in mind that everyone can see you, and sometimes this means you should just limit your interactions if you're worried about that. I will remind everyone that your employer almost always will have a social media policy, and I've made it a point that so when I was at Hopkins, and then when I was at New York, and then even now in Iowa, I've like checked in with our social media group or our policy to check what it is, and sometimes that's simply just having a disclaimer saying, "Oh, these things that I post are mine and do not represent my employer," or anything like that. Uh, So just keep that in mind if you decide to pursue social media um, uh, involvement. This point here, not everyone wants a meaningful discussion. I remember talking to someone about the use of dexmedetomidine for alcohol withdrawal. Like someone had posted on social media, like, hey, this article came out, we should be using Precedex, dexmedetomidine for all of our patients for alcohol withdrawal. And I was like, well, I have opinions about that, and I would love to engage in a meaningful discussion. And so I like share my views, and I wasn't being like really mean or calling them names or anything like that. And then the person just blocked me. I was like, oh, okay, like that's fine. Like, you have to realize that not everyone's there to have a like collegial conversation, and sometimes people don't want to hear that. That's the beauty of social media, is that you can tailor it to whatever you want. So if you just want it to be an echo chamber, you can make it an echo chamber. If you want to see different views and opinions and interact with people, you can do that too. But not everyone is there for the same reason. And then you'll hear me say this a couple times, but don't feed the trolls. And what I mean by that is there have been people, so trolls in the internet world, trolls are people who will say things to cause a response. Usually they'll say some sort of inflammatory remark or something to get an individual angry or emotional or overly attached to what's being said. And feeding the trolls is a dangerous game because feeding them gives them power. So oftentimes, if people are being trolls, they're trolling you, and the best thing is to disengage. So I have posted toxicology themed posts before on social media. People start attacking my sexual identity or, my hair, or like, just unpleasant comments. And for some people that that alone is a reason to avoid social media, and I totally get that. For me, I just block or mute and move on. I don't engage. I know some people really like to engage those people. It's not been my personal style, and it never really will be. But just keep that in mind, that if you feed the trolls, they will just keep coming back every single time. So let's talk about toxin in social media. This is kind of why we're here. So I'm going to show you some examples of some success that I've had doing social media toxicology education. But here are some, I sat down with like a big list, and I was like, well, how can I like sum this up and like the best tips that I can give to people based off what I've learned over the past several years. The first thing I'll say is know your audience. I think when I started trying to tweet originally, like tweeting out different educational content, I was like tweeting to the world. I was like, I will teach the world about toxicology. And I realized that's very challenging because the language you use will depend on who you're talking to. And I found that if you are choosing to choose like a group like medical students or toxicology fellows, you're going to be phrasing things slightly differently. So know your audience and know who you want to be receiving this content. Okay, so just think about that beforehand, because then it'll help you tailor it to make it more relevant. Trial and error is sometimes the most unappealing thing. I think people sometimes like, I have this great idea for this tweet, educational thread I want to do. And a thread on Twitter is where you just post successive tweets in a row that are attached to each other. People will put a lot of effort into it, and then it kind of nothing happens, and no one really notices it. No one seems to appreciate it. And you're like, oh man, I spent like all day working on this. It's a shame. Like I feel so defeated. Sometimes it just means trial and error, figuring out what works, what doesn't. And again, revisiting like, who's your audience? Did you, not, did you put too much content? Did you put too little? Did you have some information overload? Was it, oh, excuse me, sorry. My alarm. So, trial and error is going to be something that's important, and I have done hundreds and thousands of times on social media. Quality over quantity is the name of the game. I think people think like, oh, you get on social media, you have to make like 900 TikTok videos, or you have to do a YouTube video every day, or you have to do a Twitter post every 20 minutes. Like, no, that's a little bit much. And I think honestly, like, you will dilute out your your good educational posts or content if you keep overloading with too much. So it's always going to be quality over quantity. Again, like I said, not every piece of content will be a hit, so to speak, but I find that even if you put effort into something, I found that like if I make a case and I'm like, you know what, like I don't think this is a great thing to put on social media, or I put it on social media and it doesn't really take off, I can still use that case when I'm like teaching residents or trainees or something in person, right? So I usually like to take these cases and double dip them as much as I can to make sure I'm getting as much teaching out of them. So just because it's not a hit on social media, it doesn't mean you can't use it for teaching in the real world. Information overload is real. I think if you were to ask, for example, a toxicologist to go on Twitter and talk about acetaminophen, oh my gosh, like how many, how long do you think that would be? It would be like going on for days, right? Like, so I think being able to sum things up and be, not too verbose, which is, for those who know me, know that is a challenge of mine. So avoiding information overload, making sure that you're giving something that's digestible, but still relevant to your audience is key. And then finding a style that works for you. For me, again, I could go back and show you all the posts I did from 2017 and 2018 and 2019, just trying to figure out a style that really worked for me. I think what I ended up settling on, which seemed to work well, was these case-based vignettes, usually employing humor to sort of captivate the audience into reading further, or some sort of mystery that encourages someone to read further. And then because of the humor or because of the mystery, I encourage people to keep reading. And once they're there, once I got them, then that's when the teaching occurs. And so that's something that's worked well for me, and that's actually kind of how I teach in real life as well. So it worked out quite well. But again, that wasn't what I initially started doing. And if you go back and were to look at these old blog posts I did for in my residency, or to go talk to Andrew about the tox cases I wrote, that's not really how I did this. So it took me a while to learn the style of mine. And lastly, do not feed the trolls. If you're teaching about diphenhydramine and someone says, "Well, I just read that you're wrong because blah 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 blah," and they're like making up some stuff that's trying to get you angry or enraged or anything, you just can't take the bait. I think that's easier said than done, but there are a lot of people who literally go onto the internet with the sole goal of trying to, quite frankly, piss each other off. And personally, that's not what I'm there for, and so I usually disengage. But feeding the trolls, I think, will take away from the content, especially your educational content, if that's your goal. So this is actually one of the first posts that I did that I think that was like, it was the first time where I was like, ooh, like maybe this is something that could work out for me. So in fellowship, I remember my fellowship director, Dr. Rana Biari, like one of the smartest people I've ever met, was telling us about this case report. And I was like, this is so cool. And I was like, I wonder if I could turn this into like a teaching case, because I feel like toxicology is one of those things that is very intimidating. Like I was just chatting with a resident today and they're like, ooh, toxicology sounds cool, but like there's all this like stuff in there that like, the chemistry and the structures and the math. And so like I think I was like, how can I get people like hype about toxicology? And I was like, we have some cool stuff in here. Like that's really neat. And for me, the thing that I think is really neat is like these mysteries. And so I was like, ooh, like how can I frame this as like a murder mystery sort of thing? So I wrote, this is something I wrote in April of 2021 when I was a Tox fellow after reading this case report. I'm not sure if it was for one of our journal clubs or not, but and then from there, I introduce the case. I give clues. I incorporate some humor. And what was interesting is that I found that it wasn't just, my goal audience was mostly medical trainees, so medical students and resident physicians. But I was very surprised, because I just didn't know any better, the amount of not just medical students and residents, but also like physicians and attendings and people who have been practicing for a long time. I've had some orthopedic doctors reach out to me and be like, I didn't know this about like plaster of Paris. And, it's very interesting. So it seemed to work well. And so I was like, okay, like I may have found a sort of niche that works. Obviously, if I'm giving like a formal talk in person, I'm not going to like draw like a meme like I have here on the presentation. But the advantage of social media, I feel like, is that there are some unique things that you can do through social media that are a little bit more challenging to do in real life if you're teaching. And so highlighting that can be sort of a strategy for efficacy. I wrote a few other tox murder mysteries that really sort of got good feedback on. This was a case of, this is based off of a real case of a patient who suffocated after carbon dioxide went off in a bank vault. So we were talking about asphyxiants during fellowship, and I was like, "Ooh, this is very interesting." And what's cool is that I've had a lot of people say after reading this, they're like, "I didn't know this counted as toxicology," and I'm like, "Of course it does, right?" But then I think back to when I was a medical student or a resident, and I didn't know what did or didn't count as toxicology, and so something that I am very happy about is that I've been able to show people what toxicology is and how cool it is, because we know there's not a ton of us, and we know that we're not everywhere. And for some people who don't have a toxicology role model or a toxicology colleague they can talk to, I've learned that this might be the first exposure some people have into the world of toxicology, and they didn't even realize it was a specialty. So I've been really pleased with some of the uh, engagement and interest. I have, Dr. Hoffman will appreciate this. I have done so much advertising unintentionally for the Goldfrank's textbook because everyone's like, whoa, like, where can I read more about toxicology? And I'm like, well, check out this book. Or people are like, where did you like, read about this for the first time? And I'm like, check out this book. So I don't know. I feel like I should, you know, be receiving some of that. I'm just kidding. But really, I think it's been cool because I've been referring people to a lot of, toxicology resources. People ask like, "Oh, are there any other blogs that you like?" I tell them about the Tox and the Hound blog, and so really been sort of spreading the word about the goodness that is toxicology. I've done some visual stimuli as well, which has been well received on social media as well. Uh, and I think this is interesting because if you're just like scrolling by a picture, these are suddenly these catch your eye, these catch your attention, and you're initially engaged even though you don't know what's going on. So, for example, on the left, if you were just looking through, the content itself like is educational, which could be boring, right? And that's might not be why people are on social media. But what I find is a strategy. If you find a way to rope people in before they know it's like an educational content, they might not realize they want to learn about it. So you sort of take advantage of the fact that you have a eye-catching stimuli. For example, here is a picture of purple urine, which of course you scroll by that really quickly. You're like, what is this, right? So you're going to look at it. You're going to read the very short like sentence that I have there. If I had like a long paragraph, that might be too much and people would disengage. So learning how to be succinct with a like a catchy visual stimuli is important. On the right here, Bob did this in real life with his blood. This is not Bob's blood, uh, but this is just some pictures from the internet of doing a drop of blood from a patient with methemoglobinemia versus without, just to sort of exemplify this sort of visual stimuli as well. And it's really cool. People engage in this, and this is fun, and this is a way to rope people in, right? I think if we scare people off in toxicology, in my opinion, by being like, "Hey, check out this Krebs cycle." Like that, like strikes fear into the heart of many people, and is like a cause of trauma for like many people. Like, I don't want to think about that again. But I'm like, yo, like purple urine bags, that's toxicology. Like different colored blood on a gauze, that's toxicology, right? Like simple asphyxiants or things like that. That's toxicology. And so, moving forward into this realm of like plants and mushrooms, Dr. Goldfrank really taught me a lot about plants and mushrooms, and I developed a bit of a passion for them. This also happened at the same time that I was watching that hit TV show Yellow Jackets, where the plot of Yellow Jackets is this like soccer team, their plane crashes on an island. And I remember, like, I think I was watching this show at the same time that I was learning all about really diving deep into plants and mushrooms. And honestly, Since I apparently can't think about a lot of things, I was thinking about Yellow Jackets, the TV show. I was thinking about plants and mushrooms, and I was like, what if I combined them? And I think on the right, I give an example of like your plane crashing and you and Shania Twain are the only survivors. That was probably because I was listening to Shania Twain that day, who does have some hits. But I was listening to Shania that day, and I was like, oh, like this would be like a fun little made up case. And people really like these. I realized that plants and mushrooms is something that medical students don't learn about, residents don't learn about. I think on EM boards, I think the only plant we needed to recognize was digoxin, and even that was like, like, oh, you're probably not going to get asked about this, but like this is a sort of a huge. Well, there are many plants and mushrooms out there, and so I started to write cases like this. And again, it's a very short blurb. Like the first sentence is 3 words, right? It's very short, it's very sweet. Your plane crashes. That immediately engages the person into suddenly being like, oh, like, let me keep reading. Then the second sentence implies that this is fictional, right? And you're like, okay, like, I have crashed in a plane. It is fictional. And you're like, why are they saying this? Let me read more. There's a picture here. You engage people early. You keep it short. You don't do information overload. And my audience here, uh, uh, at this point, I was starting to expand a little bit more out to the general public, but with still a lot of medical students and trainees because I talk about management of toxicity. Again, I've done some other cases that sort of exemplify these like fake scenarios. I have found that using some sort of visual stimuli is really, really helpful to sort of grab people's attention. And keeping your pulse on like what's funny or what's popular, what's trending. You don't always have to do that, but it can help. Certainly, I think this was the time of the year that this name Brightly was trending on Twitter for the way it was spelled or something. So I just included that in one of the cases. So if anyone were to type that name into the search bar, it would pop up. Again, here is a case that I was doing about you know chewing certain seeds or beans versus swallowing them whole and the management of the toxicity associated from this. And these aren't things that people would learn in their residency or 30 years of practicing. Like this is something you would never have seen before, but still is medicine. So I will say though that you don't always need a picture. Sometimes you just need a good vignette. And I feel like for toxicologists, like if I gave this vignette to anyone in the audience right now, we would immediately know what it was. Like I think everyone can read this and know what this is, right? This is almost like bread and butter toxicology. But the reception I got on this and the amount of people who told me they went out and bought carbon monoxide alarms after like seeing this tweet just like made my heart like soar because I was like, oh, like sore and I like flying, not like sore as in like hurting. Because I was like, oh man, I'm so excited that people are like, you know, from a public health standpoint, that's toxicology too, right? That's like what Goldfrank always says. Public health component is huge in our field, and the fact that I had encouraged people to get carbon monoxide detectors or check their batteries on their carbon monoxide. One of the medical students here at the university texted me a picture of their their carbon monoxide detector that they got. So I think it's really really cool, this sort of bridge between social media and public health. And this tweet you can see after Elon Musk implemented on Twitter the showing the view counts on the tweets. You can see it's got 4.2 million like impressions. Like 4.2 million people were seeing this. It's pretty impressive. And I don't know if that means 4.2 million people check their smoke alarms, but from what I had heard and from what I received, I thought this was a really really cool that I was able to reach this many people. And again, there's no picture here, no fancy pic. This was just a classic like toxicology presentation that like we've all heard before, right? So I don't know. I thought that was really neat, and so I've had success even without strong visual stimuli. Lastly, from a public health standpoint, I've been really able to advocate for the Poison Control Center. I think there's been a lot of myths out there about the Poison Control Center. Like people have asked me, like, "Oh, I thought it costs money to talk to a poison specialist," or "I didn't know my state had one," or "What's the number?" or like, "Can anyone call it? I thought you could only call from a hospital," or um, no. And so I've been able to really take it upon myself to not just advocate for poison centers, not just advocate for the toxicology textbook, like I was mentioning, but even advocating for acknowledging your sources, right? I think sometimes people will just, as we've seen, people just put things on the internet, don't say where it came from. So I usually like to do my best to say where things are coming from, but sometimes that's a little bit challenging because you can't link to like 100, PubMed IDs on a tweet. Unfortunately, I wish you could. But so there's a public health component as well, and I've been uh, pretty excited about that. And lastly, I think it's really sweet the amount of people who ask about careers in toxicology. Even before this was something I tweeted earlier last month, or just last month, towards the end of last month. But for the past several years, I've been getting messages from people asking about careers in toxicology, and I never anticipated that this would happen. I would never anticipate like my little Twitter account that I used to look at EKGs suddenly becoming like an account that people ask about. Hey, like I'm an internal medicine doctor. Can I still do a toxicology fellowship? Or like, oh, like how long is tox fellowship? What program did you go to? Can I rotate there? Mark Sue, I know, will tell you that I've definitely sent more than a few people his way that have been interested in rotating at the New York Poison Center, uh, and have just reached out to me with questions because people are interested after realizing what toxicology is, right? This isn't something you get, like I said, this isn't something you get exposed to a lot in medical school, right? Like, you know what nephrology is because you have a whole day on, or a whole unit on nephrology, but there's not like a toxicology unit at a lot of medical schools. And then once you start your training, you see it a lot. So I think there's a lot of untapped potential here because people just don't know. So I would love to see more toxicologists in the future, and so I'm always eager to answer any questions whatsoever about this. And so I've had good success with this. And I think that's a great part about social media too, is that toxicologists on Twitter, I think it's fun because if people see us talking about different cases or what together, they can it sort of builds up how, dare I say, how fun or how cool this field really is. It's more than just like complicated math and chemical structures. Like even today I was talking to a resident who's like, I really like toxicology, but I just don't like all the organic chemistry. And I was like, well, there is, but like that's not like, I'm not sitting every day drawing structures. Like I'm taking care of patients. I'm doing clinical toxicology. Like so, there's a lot of misconceptions about what the field is. So really advocating for what we are and what we do is really helps to get the word out there. And with that, I will end. Thank you everyone for your time. I'm delighted to be able to speak about this today. It's a passion of mine that I really think is going to become more and more popular. Just education and social media, and I think it would be beneficial for toxicology as a specialty to embrace it because it truly isn't going anywhere. Uh, and I think at in addition to education on social media, combating the various misinformation that can be out there and being an advocate for our field, I think it's really important. But thank you everyone for your time. I really appreciate it. And I'll take any questions.
Awesome. Thank you so much, Josh.
Oh, thank you.
Okay, anybody in the group have questions for Josh? Someone has a question in the chat? Josh Bloom, you see anything?
So yeah.
Here, let me get the mic.
Wait, since I can read the chat too. Are these the same things that I see?
Oh, wonderful. I'm glad you can read.
Oh my gosh, I'm being bullied. You're bullying me in front of everyone, so everyone can see this.
We miss you, Josh. Miss you lots.
You too. Be nice to tweet about potential CO danger of portable generator misuse. Yeah. So I think that's something that when I originally tweeted about carbon monoxide, it was during, I think, was it January or February? I tried to time it so it was in the winter months. I'm already planning on doing some cool hyperthermia discussion during the summer. So I do try to time it so it's seasonal and irrelevant because I have heard some people say that they start to look out for these things when the seasons change, and that's what we want people to do. So I do think timing it would be great, especially after these storms that we get, especially out here. Uh, Steve Marcus says, "How did you get found? I once tried to set up a blog, no one showed up. Um, well, I think I think I never really got found. I think I just started to interact in the community a little bit more. So social media, like anything else, there is like a community. You can imagine that if if I went to New York Poison Control Center, my first day first day in New York City, and went to the hospital and said, "Hey everyone, I'm going to be giving a lecture here today. Everyone should come see it." No one would show up. But if Bob were to go and do it and say, "Hey, I'm giving a lecture," like the whole hospital would show up. You have to sort of build your reputation a little bit and sort of make those contacts and make those colleagues. And so, what I started to do when I started to get involved with social media is I would interact with these different EKG posts. I would interact with these ultrasound posts. I would interact with my emergency medicine colleagues. I would build up my sense of virtual community with these individuals. And I know that sounds a little hokey pokey, a little bit silly, but I'll tell you that going to these like the latest Tox conference I went to, meeting all the people that I had interacted with on social media that I'd never talked to in real life before was very sweet. It wasn't you would think it would be like awkward or very uncomfortable. It really wasn't. It was very sweet, and I think so. Built like working to be a part of that community, I think is really what helps you sort of grow and be found. But I think if you were to just start tweeting or writing into the void, you might have some trouble. Although some people can do it really well. That's never been my forte. Uh,
Josh, the
yeah.
lovely Rana Biari has a question for you or comment.
Oh, yes.
Josh, it's so good to see you. Thank you so much for giving this. We miss you already.
You too.
I have two questions for you. I was
Okay.
asked to ask if the methanol concentration was back. And the other thing I was hoping you could comment on, which I was, would you mind sharing with people how you got your job, or at least how you were introduced to your job? Because I think that is something that
Sure.
is worth sharing.
Yeah, so for one, the methanol concentration was this ongoing joke that people just kept asking about when I was a fellow, which was apparently still going on. So it's just this running gag that's going to probably be on my tombstone. So we're gonna leave that alone. But as far as how I even found out like about this job here at the University of Iowa, so when I was a toxicology fellow, I started to get involved with I was like, I really like teaching and I like education, and this whole Zoom format is new to me. Like I wasn't used to giving Zoom lectures in residency. And so on social media, I said, hey, like I'm a toxicology fellow. I want to give lectures to your residents for free. Like just sign me up. I'll do it. Like I want to get more experience. I'm a tox fellow. I would love to talk about toxicology. And so kind of across the country, people took me up on this. They were like, "Oh, free lecture? Sure. Like free tox lecture? Why not? Like give it to the residents." People literally had me fill in on their like tox days. They're like, "And here's Josh." Like it was cool. One of the places I lectured was actually the University of Iowa, and I honestly I wasn't even on my radar. I was like, I think it's in the Midwest. It's one of the states that starts with an I. And I was like, okay. I lectured there virtually, and we, started talking. They said the residents really liked it. Like, would you ever be like interested in like, interviewing here, coming out here? And I was like, oh, like, I'll never say no to like just checking a place out. And because of that, like I didn't even know I had my sort of foot in the door and that it was even on my radar. I came out here. I just fell in love with it here, and I am so content here. I love my job here. I love the people I work with. It's fantastic. And that was all really because of social media that like helped me even like, because I wanted to teach more, I advertised that on social media. People took me up on it. I met more people. I networked. I met Dan McCabe here at the university. And it sort of happened like that. And so it was really cool, especially during COVID when it was really challenging to meet people. I was like worried that I wasn't going to be meeting people, and so yeah, that's how that happened. So it was really cool.
Wonderful. Josh, thank you so much again for doing this talk for us. I'm so happy that you came. You're doing some great things on social media as opposed to some other people, and I really appreciate the fact that you're trying to do so much good. I want to end with two questions. One is in the chat from Marianne, if you can read, which you can read. And the other question, which I have for you, is a serious question, is I see people post things on social media of patient EKGs or
Yeah.
chest x-rays or other things like that. And I question the ethics of posting this without the explicit patient consent. I want to know how you feel
Yeah,
about that.
so that's a great point. I will never take my personal belief is like so everyone some people will say like, oh, like they'll post a picture and they'll be like posted with consent from the patient. I don't know what that necessarily means at all. I have seen over years, and I will not say where I've seen this, but I've seen clear patient privacy violations where people will take a video or post a picture of something, and I'm like, you cannot do that. Like, that's just a complete patient privacy violation. I think you have to be you have to be cautious of what you're doing because you would never want to violate someone's privacy. Usually if I'm posting a picture or some sort of visual stimuli, it's going to be from a published case report or something that's available. It's not going to be like a patient I am taking care of today, right? I always think that's a little bit I think that's inappropriate. I think people feel differently about that though. Like, people are like, oh, like for anonymity, like I have, blurred out the name, but I see people like say like, oh, look what this, even things like, oh, look what this like urinalysis grew out. I'm like, I'm pretty sure that's the only person in the country whose urinalysis looks like that. Like that's kind of identifiable, but the ethics behind it are murky. And I think at the end of the day, you have to defer to your own institution or your own employer's policy about that stuff. I don't, and for some that might be saying like the patient gave verbal consent that I could do it. Other times that's literally a written consent. So you really have to be cautious. But I don't think there's a blanket answer. I do think there's a blanket answer. I think the blanket answer is if you're concerned that it's a patient privacy violation, then don't do it. That's good enough for me. So the advantage that I have is a lot of my cases are based off fictional presentations, and so I'm not really like saying what happened. They might be inspired by real cases or cases in the news, or published case reports, but never going to be like a direct patient's EKG or something that I have taken care of. I don't think that's the most appropriate. And then the question in the chat is, how do you tell people to guard against misinformation by someone tweeting? It's challenging. Sometimes some of the biggest accounts are huge proponents of misinformation. I will not identify those accounts here. I don't think that's the most appropriate venue. But what I will say is that these are very, very popular accounts that can really contribute a lot to misinformation by saying certain things or doing certain things. I used to think that the best way to combat this was to ignore it and not draw more attention to it. However, I find that the more people that are using social media for access of information, it's sometimes important to get good information out there. So um, sometimes combating the misinformation with the actual information can be helpful, but that's exhausting and is more than a full-time job. Like if you wanted to go combat every toxicology myth on social media, good luck. I can't even keep up with all the stuff I see on Twitter. Like, and then I'm sure everyone is aware of the fentanyl panic that's sort of been really taken the world by storm. Every news organization's covering it. There's so much misinformation out there. It's really challenging. And that's one of my biggest concerns with social media is just how much misinformation is out there. And not to get too soapboxy, but I feel like outside of toxicology, there's just so much misinformation on the internet that being someone who can openly say who they are, what their credentials are, what their sources are, like, and then teaching people, like that's sort of like what I like to do, and that's how I combat that. But I wish there was a way we could have a full-time team employed by some sort of neutral organization to combat misinformation. I would sign up for that, but I don't think there's an easy way. But yes, sorry, not a great answer, but It's what it is. Well, thank you everyone for your time. I really appreciate it. I know it's right at 1 o'clock, so I don't want to. I want to be conscientious. I know Tox in the News is going to start soon, I believe.
It definitely is. Thank you so much again, Josh. We miss you really
Of
so
course.
much, and we really appreciate the talk. Thank you.
All right, thank you everyone. I appreciate it.
Take care.